can dose the insulin and take some of the fear away.
Thank you.
Senator Cassidy.
I will defer to Senator Marshall.
Thank you, Dr. Cassidy, and thank you, Chairman Sanders. Mr. Jorgensen, welcome, and thank you for attending this hearing. Look, Novo Nordisk is not the villain in this story. Novo Nordisk is not the villain in this story. They're a hero. We should be here celebrating this miracle innovation that's responding to this diabetic epidemic we have in this country. It's a miracle drug. 38 million Americans with diabetes that we're helping out. This nation is spending $250, maybe $350 billion a year treating diabetes, not to mention the loss of work. And here's a drug that's going to help us treat the problem. Now, we all agree on this committee across the Senate that the cost of health care is too much and that prescription drugs are too high, especially the out-of-pocket expenses. But we need to figure out who the villain is. Who is the real culprit here? Who's making the money? So on this particular poster, you've said it once, you've said it twice, everybody up here said the same thing. Whatever the cost is, whichever number we want to use, Novo Nordisk keeps 24% of it, and the PBMs extract 74%, 26 and 74%. So really the PBMs are making the bank here. So let's talk about PBMs for a second here. The real culprit in this room, in this story. So these three big parent companies, the three big PBMs control 85% of the industry. Their gross revenue last year was $800 billion. Their parent companies, gross revenue, $800 billion. This committee's worked so hard on PBM reform. We've not passed our delinking bill, and I would ask the chairman to consider bringing the delinking bill back to the committee and let us mark it up as well. In that delinking bill, PBMs would receive a flat fee for their efforts as opposed to a percentage of the sale. So we'd go to a flat fee model. And next, there just can't possibly be enough transparency on this issue. You know, I came to Congress to save Medicare. The people of Kansas sent me here to save Medicare. I cannot save Medicare without a miracle drug for Alzheimer's. We're spending, I think, way over $200 billion on Alzheimer's disease. So if we thwart the innovation that this type of company does, it tells people to stop researching drugs that are going to solve Alzheimer's. Mr. Jorgensen, let's talk about research and development for a second. How many years have you been researching diabetes, and then eventually you got, probably decades ago, you started going down this Ozempic path, and how many other rabbit holes have you all been down?
Yes, thank you, Senator, for the question. We have a 100-year research effort in diabetes, and the past 3 decades we have been researching the GLP-1s. Starting in diabetes and then in obesity. And when we started the obesity research efforts, everybody thought it was a stupid idea.
Yeah. Sorry to get through this. So you've spent 3 decades specifically on the GLP-1 model, and I'm sure that there was lots of molecules that didn't work out, and at the end of the day, you've spent in excess of $10 billion of research. And then how much money are you going to spend on research this year, approximately?
So we are spending approximately 14% of our turnover on research.
Okay. I want to make a quick point here that companies like yours benefit from the Trump tax cut, the research and development dollars, the tax cut on that expired. Is that true that doing research in this country, you benefited from that tax cut?
We have no, funding support from the NIH whatsoever in our research efforts. We benefit from tax benefits in different situations.
So being able to write the R&D off over a year as opposed to 5 or 10 years would be a significant, would prevent you from or decrease your reinvestment opportunities.
Yeah, perhaps. I'm not. I don't know the specific data in terms of how much we're benefiting from it.
The one thing I am disappointed in your company and all big pharma is the marketing that they do. I think that the marketing is very influential. I really think that Congress needs to go back and revisit that as well. I think that the marketing is so good. There's people on this drug that shouldn't be on it and are being taken advantage of. And so I do think we need to go back and look at that. Again, instead of coming after the hero of this story, we need to look in a mirror. America needs to look in a mirror that nutrition is a big problem in this country and lack of activity. The chairman, ranking member, all of us have worked on community health center funding. I think that's where the opportunities to work on the nutrition problems remains. So it's frustrating to me that Congress can spend $1 trillion on the military, Medicare can spend $1 trillion, but we can't spend $3 billion on primary care. $3 billion to address the primary care needs of this country, which I think would have a big impact on driving down the need for these type of expensive drugs. America, I've said it for 20 years as a physician, that America suddenly wants drive-through health care. We want to drive through a fast food service that gives medicine to fix our problem, rather than addressing the real challenges before us, which is our nutrition in this country is horrible. So I think that's something we need to continue to work on. The other thing we can still work on is bringing competition. Promoting competition to you will bring this price down. We've passed legislation, the president signed legislation that helps drive biosimilars and generics to market more efficiently. There's several in the hopper, so to speak, but still the FDA remains very inefficient. Very inefficient. The FDA should focus on the safety of the drugs and then let the physicians and the patient decide if they're right for them. And that type of a model will drive down that process by years. And I'll just close, one more time emphasizing that this committee needs to demand that the leader bring our PBM reform to the floor, but we need to include that delinking bill. There's other opportunities to drive this price down again. Again, Novo Nordisk is not the villain in this story. Thank you. I yield back.
Thank you. Senator Hassan.
Thanks, Mr. Chair, and to you and Senator Cassidy for this hearing. Mr. Jorgensen, this year,